7 years ago, PFHI was started with a vision to ensure better health and well-being through faith. And since then, a number of milestones have been made through the interfaith-led model, which was enhanced with a multi-sectoral approach. We've been able to work in 20 districts at national level with support from a number of donors, Bill and Melinda Gates, through PI, Population Action International, New Venture Fund, FP 2030, FP 2020, World Bank Global Financing Facility, and USAID, among other partners. Through that interfaith-led model, we've been able to train over 200 interfaith religious leaders. We've trained media as champions. We've trained cultural leaders as champions of reproductive health. We've trained political leaders, both at parliament and the local councils. And we've been able to mobilize resources. Over 20,000 US dollars was mobilized through the USAID funding in 11 districts. Over 200,000 US dollars was mobilized for family planning through the PAI Bill and Melinda Gates project. We've been able to work with a number of sectoral partners, civil society, as well as a number of development partners. We believe that if religious leaders are mobilized, capacitated, provided with tools and materials, they can be change agents in terms of influencing behavior, addressing social cultural barriers, as well as influence policies and investments for health. We've been able to train over 200 interfaith religious leaders from the different faiths, the Catholics, Church of Uganda, that is Anglican, Orthodox, Uganda Muslim Supreme Council, Seventh-day Adventist Union, and Born Again as healthy champions, mainly focusing on family planning and reproductive health. To enhance the multi-sectoral approach, we also trained media as health champions for family planning and reproductive health. We trained cultural leaders, political leaders, mainly parliament. We have what we call a political caucus in parliament for health, to strengthen the reproductive health and family planning policy and investments. The local councils in 11 districts who we trained as champions, and they formed what we call the family planning political caucus. And we've developed a number of tools to support these champions. For example, we've developed a family planning message guide, budget tracking, champion building, and also how to engage with religious leaders on issues of health.
We, the Faithful Family Health Initiative, hold the view that if faith leaders are mobilized, capacitated and engaged, their voices and actions documented and amplified, then they can become a catalyst for behavior change, effective agency for healthcare delivery, and indispensable actors for health policy influencing, thus contributing to better family health and well-being. Convening Power. Bishop Stephen Kazimba integrates family planning in religious structures during the Uganda Matters Day commemoration.
This has nothing to do with the one denomination. It has to do with all people working in collaboration, communication, coordination, and connection.
A platform and influence, Deputy Mufti Sheikh Ali Waiswa gives the stand of Uganda Muslim Supreme Council during the 3rd National Family Planning Conference.
Muslim religious leaders made a consensus on this subject, and we wrote out publications as guidelines to guide our clerics and at the lower levels to be able to address issues of family planning.
Focusing on 8 districts: Mityana, Mubende, Kyenjojo, Iganga, Kagadi, Namayingo, Kabaroole and Busia. A number of achievements have been made. Allocations to family planning stand at 864 million Uganda shillings. District costed implementation plan 6 have been launched, 1 approved and 1 drafted. Health executive and civil society engagements have increased and been strengthened at district level.
Most districts anyway, they have not taken family planning serious, and the amount of money dedicated to that area is little or not there. So it is high time the gender ministry to look into that, and those responsible for the budget of Uganda, for the districts to look into that, because that is an area which is going to help us.
I am also known as a champion for family planning, as you saw boys, and I'm not complaining because I have girls now.
Does God allow us now to have as many children as we can? This is where we are supposed to work as religious leaders, as leaders in our societies. We are supposed to help our people look at the dynamics of society, look at the economic challenges that we face, and advise our people accordingly. If you cannot afford a large family, yet get your children when you can afford them. My conclusion therefore is, you must plan your family, you must have children at a time when you can handle them, so that the issues of transformation come. God is a transformer of societies.
And harmonize healthcare prices across the country to save especially the indigents.
And the way a Panadol would cost in the would cost me in the hospital, government hospital, is not the same way it is in the black market or in the pharmacy. To the extent that I have even to call some people at home that please sell even the little coffee which is there. So, the way we are spending money on medicine, it is too much.
Some people are telling you they have sick people in the hospitals. Some of them are being held because they can't pay the dues. Yes. So we end up doing what we can. Sometimes we contribute a little, and then we do the best, that is praying for them, for God's intervention.
Nobody at this stage can pay their hospital bill at any given rate. No one. I don't know anyone. But the point is, when there is no insurance cover, then the cover has to be borne by those around you.
But the first ever crucial enabling bill is still pending assent by the President since the 31st of March 2021, when it was passed by Parliament.
We'll allow policies that help the people with this burden.
It guarantees life for our people and for our future generations. A healthy country will always develop.
I am tired of attending funeral services, and we say it has been God's will to take away this person. Death can be postponed.
In fact, we are late because people have struggled. People are scared of going to health centers or hospitals because they know they don't have money. Others who have gone to private clinics, they have been given bills which they even don't know what to do with them because they can't afford the bills. So with health insurance, all that would be taken care of. Nobody would be worried about what to do when...
Number 3, which means that everyone should access health services. So when you get this scheme, this new financing mechanism will help our people to achieve or to get the health care, even those who are poor. So I think when we start this scheme, it will be so important to everyone in the country.
Yes, we want a good economy, but economy is going to be spearheaded by people who are living, not dead people. So life saving should be given priority. To His Excellency the President, we say, yes, Your Excellency, you are doing enough, you are trying. Even during the lockdown, you guided us well, but to be permanently sure that the lives of Ugandans are protected is you to assent to the National Health Insurance.
They request him kindly to definitely sign this bill to become a law.
Our topic today is investing in adolescent matters. A report by Adolescent Health Commission underscore the importance of investing in adolescents. Improving the physical, mental, and sexual health of adolescents aged 10 to 19 years at the cost of $4.6 per person per year would bring a 10-fold economic benefit by averting 12 million adolescent deaths. Let's look at the budgets now. Is there a deliberate move to secure the future of our young ones? So there is a weak prioritization of adolescent health in government programs and budgets. There is lack of leadership and life skills among adolescents. Friends, on the question of what needs to be done, I'm quick to observe that the faith community are recognizing the importance of providing safe environment for younger people. All places of worship, we say the mosques and churches, faith-based schools, are places where moral values are formed and strengthened. Self-esteem is cultivated and life's lessons are taught using the holy scriptures, that say the Quran and the Bible. I would like to applaud what Faith for Family Health Initiative 3FHI and their faith partners are doing in improving the health outcomes of adolescents and the younger people in this country. Thank you very much.
We have come a long way, but there is still a need for more progress, especially in the area of reducing teen pregnancy, early marriage, and preventing gender-based violence. Where the concerns of the church overlap with the development agenda of the UN and NGOs it funds, we shall join together in a common cause. For example, like the UN, we are very concerned to improve reproductive health in Uganda and to reduce maternal and infant mortality. Surely our youth need better sexuality education. We agreed on that.
According to me, should allocate enough funds specifically for the children, women, especially mothers who deliver in problems, and also have a full-fledged budget for these, for the antenatal, for the adolescents, and for women, because we discover that many women are dying while giving birth, and there are so many adolescents, the girls who are being raped. There are those who are getting pregnant when it is still early because they lack knowledge, they lack information. They have not been told that there is anything like abstaining. The parents are not strong on giving them guidelines that can help them really to stand on their own and say, excuse me, it is not time for me to involve myself in sex, to give. Yeah, personally, I try my best to educate the community and the believers who come to church. I urge also the other religious leaders and the stakeholders, and of course also the government, to help the religion, to help to voice their issues, to also to share with the religious leaders, so that, because the religious leaders have got a lot of information that they can give to the community, but sometimes they are not well facilitated, or they don't have access to this information. And in most cases, they also do not have a chance to go for these seminars that they can help them, and sometimes they are not approached. People maybe think they do not have this information.
An inquiry by a select committee of parliament in 2019 revealed that 77.7% of primary school children experienced sexual abuse while at school, while 82% of students in secondary school experienced sexual abuse, of whom 8% had been defiled.
Yeah, even though government has done its part, there is still a lot that needs to be done. For example, enforcement of the laws. Most of the cases are not well handled by police. We have files getting lost. There is a lot of money involved, and most of these survivors are vulnerable people. So when you talk about money, someone runs away and they never come back to report.
We nafuna olubuto lw'ono omwana era yandepinga bulepinzi kubanga yajja kiro yandepinga kubanga twali tetwakiriziganya eyo mboozi mbasagala girowoozaako aliwo wempulira n'obusungu ng'omwana nyibi.
The future of promising young girls and children has been shattered. Some have died, others have survived to narrate their ordeals.
You see, such a kind of situation, we have weak laws. We need to strengthen those laws, and we need to see culprits being punished.
The reality of how big the challenge is in the Ugandan society is seen through spiritual leaders to whom many victims run. Others die in silence.
While we're discussing this, we need to know how much supplies do we have and how much products do we have to address the issues of family planning. I'd like to remind you a few issues regarding the policy dialogue on holistic financing of family planning supplies in Uganda, and issues that we have been discussing throughout the last year events, which are very important to continuing to pursue issues related to family planning. Interventions using a multi-sectoral approach at the national and subnational level. Regarding financing for family planning communities, as part of the Family Planning 2030 Global Partnership, Uganda launched 6 commitments at the end of 2021 as a pathway to achieving the targets of increasing the modern contraceptive prevalence rate from 39 to 50%.
We keep reminding them that you have made a commitment, but how do we support them to fulfill that commitment? We are not auditing them, but we are working together. We want to ensure that we have that mutual understanding, mutual relationship to engage them to fulfill those commitments.
Partners have been tracking budgets. Some of us here have been tracking budgets over time, and majority of the partners do not go beyond the allocations. The allocations means the money that appears in the budget that is supposed to do something. But this does not just, looking at the allocations, does not answer the questions of how has this money been utilized and has it actually reached the end user. So this study sought to go further than that, further than the allocations and disbursements. Disbursement is, now that the money has been allocated to this entity, has it actually moved from the budget documents and whatever, has it been sent to the accounts? For instance, from the Ministry of Health, has it moved to the entity? Has it moved to the Ministry of Finance, Planning and Economic Development? Has it moved from there to the specific entities like the Ministry of Health or the National Medical Stores? And how often does this happen? This normally happens on a quarterly basis. That's the step that's in between the allocation and the expenditure. What I'm understanding is
benefits, and that is universal health coverage. So if we can work together and we don't look at government as government, because we are all citizens of this country, so we are part of a program, we can achieve for family planning. So the study was looking at where are the gaps.
It's really for us to be able to implement the national health insurance as part of the financing strategy. So I would want that as we put advocacy and accountability, we should also be able to push advocacy on the demand side so that we can have resourcing into one.
Modalities that we see in our country. We acknowledge that family planning plays a central role in improving the health of mothers, infants, and it empowers women and reduces poverty. Third, we recognize that through various policy instruments, government of Uganda recognizes the importance of investing in family planning to facilitate scaling up, access and uptake of family planning services and all the other commodities that come along with it. We as political leaders, we commit to ensure that government fulfills the policy commitments.
We need to look at the focus of our accountability should be at two fronts. One, increasing domestic allocation, which I really see, the pledges, the commitments, the declarations are quite strong on that. But I haven't seen so much on how we can also better and more efficiently use what's being allocated. I think the conversation has skewed a bit to the first, and we didn't dig that, a bit deeply into the second, and yet that's also very important.
But also we will leverage on our considerable know-how of using diverse communication channels, methods including our media outlets, publications, illustrations, to influence political decisions on RAMNAC investments, budget allocations, and accountability. For implementation, we are looking at full implementation of RAMNAC sharpened plan. Objective one is strengthen leadership and coordination of national RAMNAC coalition on overall RAMNAC plus N funding in Uganda and the special implementation of sharpened plans. We all know that we've been doing this. We've even had a study that Patrick did, trying to track and see what is it that has been done and the resources.
MNCH Youth Summit, or in other words, we can call it the Pre-Safe Motherhood Conference, and it's a discussion we're taking up with the Naguruti Information and Health Center. And our colleagues from Butaleja are organizing a national stakeholders consultative meeting on adolescent health and well-being. That is a leading event to the 1.8 billion global campaign by PMNCH, nationalizing the regional forums in western, eastern, and the northern regions of Uganda. And
responding to GBV, and then also identifying capacity gaps for the forum and forum members. And lastly, we came up with recommendations, what we think we can do, and we formed a resource mobilization committee, which is again some of the members we have agreed on here are part of that resource mobilization. And what we are doing now is we are agreeing on the on our action plan, what we need to implement. And thanks to World Vision and MBBO and FUME who funded that meeting. And then lastly, we had the forum members supported the launch of the Uganda Men Parliamentary Association. So it's an association of male and female members of parliament, and it's
one of our strengths has been having a functional steering committee. That's not a lot of money. We can now pool resources under steering committee. But what worries me, we don't have money to convene our members physically on quarterly basis. And that's where our strength is. Now, for us who are saying that we are going to do a webinar, webinars might not work for our community members. We will try, it's something, it's an innovation, but we need to look for money. At least if we can't do quarterly, let's do biannual, where all our members come and we're able to pick those issues. The other one that is also, I see clearly, we've been tracking finances, the studies that we've had. Now, Patrick is about to share one with us. You already shared, but maybe we'll disseminate it at some point. If that study is done and there are gaps and recommendations, and we are supposed to engage, at some point after some time, we are supposed to be doing more study, another study, and more studies, because accountability is about evidence. You're not going to call decision makers and start saying we have
that, so that we communicate right. Because civil society has a way they communicate. The medics have the way they communicate. You find that the religious leaders have a way they communicate. And I've realized the president, when he is writing to religious leaders, there is a way he also communicates. I think
we shall need more time for that. And we pray that resources will be there to allow us to have more engagement. I also thank the members for their time.
Looking ahead, we are looking at consolidating the gains and sustaining the impact by ensuring that the work we've done in the 20 districts is able to continue yielding results, by retuning our champions, strengthening the multi-sectoral approach, but we are also looking at scaling up and expanding to the rest of the country. The faith leaders right now are very core, especially in the area of reproductive health, but also addressing issues like zoonotic diseases, the pandemics that are coming, integrating messages in their religious structures and influencing policy. But we are only in 20 districts, and Uganda has over 139 districts. So our next model, our next strategic plan 2025 to 2030 is looking at consolidating the gains, sustaining the impact as we scale up to the rest of the districts in the country.